Hello there, and thank you so much for participating in this examination. My name is Calliope, and I am going to be administering this examination today. How are you doing today? Okay. I hope by the time you leave this examination, you feel even just the littlest bit better. Is there any places at all that you feel any pain, or do you have any current illness at all? Wonderful. Okay, so we don't need to worry about that. Today we are going to be examining you with 4 very basic but very important diagnostic techniques. We have inspection, palpation, percussion, and auscultation. Now, inspection will be me looking at, for example, your face. So if I were to come in real close here and take a look at your face, I'll look at the proportions, the symmetry of it. I'll look at the pallor of your skin, your eyes, your mouth. We'll look for any skin abnormalities. Do you look to be quite sweaty? Does your skin look to be very dry? Is it very reddened? Do we have any sort of blemishes or wounds? Things of that nature. And palpation is going to be where I am physically touching you. Do you mind if I give you an example here? Touching your face? Okay. So here, let's say for example, I am inspecting and palpating along the hairline here. And I'm feeling the skin for any abnormalities. Looking for any signs of, for example, psoriasis or seborrheic dermatitis, infestation, or any maybe perhaps odd moles or marks. So we take a gentle hand here to palpate the skin, just like that. Now, percussion is going to be a little bit of an interesting one in that I am going to be tapping along your body. Depending on where we're doing it, depends on what kind. We can do a direct percussion or we can do an indirect percussion. Direct percussion is where I am physically tapping on your skin without any barrier. And we would do this for checking the sinuses, for example. Do you mind if I show you real quick? Okay, so if I were to just tap, 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 tap along the ethmoid sinus here, we would see if there's any pain or tenderness in that, see if there's inflammation in the sinus cavity. And indirect percussion would be used, for example, for the chest or the abdomen, where I will be tapping, but I'll be using my hand as a bit of a barrier. So I'll be striking my finger, and I like to do it with a 2, 1, 2, 1, 2 tap. But I'm listening for the sound that comes back. See if there's, for example, fluid in an area that there shouldn't be. And lastly, auscultation is a very fancy word for listening. And auscultation can be done with the use of our stethoscope. This stethoscope only has a diaphragm. Some stethoscopes have both the diaphragm and another attachment that looks like a cone, and that would be the bell. Each side would be better for hearing either higher or lower frequencies. And we can do auscultation, of course, on the chest. We can do it on the abdomen. We can also do it on the pulse points, or we can check for bruits in the carotid artery. So we're going to be looking at all these different techniques on you, on different parts of your body. Does that sound like something you'd be okay with doing? Wonderful. Thank you so much. So if at any point you feel any pain or discomfort, please let me know so we can investigate it while we're already here. Okay? All right, wonderful. So for the purposes of this examination, do I have permission to touch you throughout it? Wonderful. Thank you. So why don't we start with the first example with your face. I'm going to come in a little closer here. Just wiggle in a little closer. Okay. So I'm going to start by just inspecting the face. We did a little bit of preliminary inspection with our example, of course. But I just want to get a closer look. And we want to look at, for example, the hair distribution in the eyebrows or the eyelashes. We want to look for any places of flaking of the skin, any hyperpigmentation as well. Okay, and let's take a look at the ears as well. So, if we look, for example, behind the ear, this is a spot where we can find abnormalities like lesions. It's not somewhere we can see easily on our own. For you and have a little look-see. Okay, and we've taken a look at the hairline as well. Doesn't seem to be any abnormalities with that. Have you noticed any changes in your skin, on your face, your hair, even along the neck at all? No. Okay, now just take a look at the neck while we're here. Wonderful. So, let me take a peek at the head. So, I'm going to swivel over. And I'm going to take a look at the top of your head. Good. And I'm just going to piece through the hair a little bit and see if there is anything going on. I'm just going to stabilize your head here with my hand on your forehead. Okay. Let's take a little peek. And I can take a little look at the hairline on the back of the head as well. Okay. Good. All right, and the back of the neck while I'm here. And I'll also be palpating around here. So for example, back along the hairline, we have the occipital lymph nodes right here. I can also feel the back of the neck for any textural differences, or if there are any moles or blemishes, things we might need to take a closer look at. And I can feel the spine here. Right, let's bring it back. Hello. think we can do a bit of palpation here. Just going to feel the temporal muscle here. Would you mind just clenching your teeth for me? Good, and unclench. Clench and unclench. Good, let's do that with the TMJ joint here and the masseter muscle. If you could clench your jaw for me. Good, unclench. Clench. Unclench. Good, and if you could just open your jaw for me. Close the jaw. Open. Close. Good, and how did that feel? Was there any pain in that? Was there any loss of mobility with that? No. Okay, very good. And let's feel the post-auricular nodes behind the ear. Do our palpation. And then in front of the ear as well. We have preauricular. And underneath the jaw, we have submandibular and submental. These ones need a little bit of a rolling motion to feel them. If you have a distended one of these, it's kind of an odd feeling. Good. Now let's feel into the neck as well. So we have superficial cervical, deep cervical chain, posterior cervical. There's a lot going on here. We have the big muscle, the sternocleidomastoid, one of my favorite muscles to pronounce. Good. And while we're here, let's take a little auscultation, and then we'll do our palpation on the sinuses. Not everything's going to be quite in order, as long as we hit our bases. Okay, so I am just going to first palpate very gently the carotid artery, and then we'll take a little listen. Okay, I will do one at a time. Let's start right here. Okay. Very good. And then on the other side. Good. Now I'm going to be listening to it for what's known as a bruit or an audible heart murmur. What I want you to do is I'm going to have you take a deep breath in and hold it while I am auscultating. Okay? Take a deep breath in and hold. Good. And you can let that go. Take a deep breath in. And exhale. Good. Now, while I have the stethoscope in, I'd like to just take a little listen to the temporalis. There's a pulse here, right in here. So let's just do that, just for funsies. Okay? Don't have to breathe any differently. Just allow me to try to find that pulse. Bet you've rarely had someone's stethoscope on your face, huh? Good. Let's listen to the other side. This one's just for funsies. Okay, very good. Now, about that direct percussion, I'm just going to be tapping along your ethmoid, your maxillary, and your frontal sinuses. Do let me know if there's any pain or tenderness. It is indeed allergy season, so some people are really feeling that in the sinuses. So just stay still for me. Good. Any pain or tenderness in this? Okay. And if I were to do that along the maxillary sinuses, right above the maxilla. Nothing here? Okay. And what if I were to do that on the frontal sinuses here? Nothing there? Okay, wonderful. So let's work our way down. Now we have the chest, of course, would be next. So for the chest, we do inspection, palpation, percussion, and auscultation. Okay, in that order. It switches up when we get to the abdomen, but that's going to be our order for the chest wall. Now, firstly, I'd like to inspect. And here we're looking for example, scars or deformities in the chest wall. I'm also just watching how you breathe as well. See if there is any difficulty in that. And if so, what exactly it looks like. Is it trouble on the inhale? Is it trouble on the exhale? Good. We can just feel the chest wall as well. Do our palpation. And we'll also be doing this for the posterior chest wall, also known as the back. Okay, and I'm going to feel the chest expansion. So I'm going to put my hands on your chest, and I just want you to breathe in as deeply as you can. Good, and then out. Okay, breathe in and out. Wonderful, wonderful. So now we can do our percussion. Now with this, I will be placing my hand around the chest and striking my finger with my other finger. I'm going to be listening to the sounds that come back. Okay. All right. Good. Let's do some auscultation. So first I'm going to listen to you breathe, and then we're going to listen to your vocal resonance. So I am going to be placing the stethoscope on your chest, and I'm going to first listen to the lungs. I'll listen to the vocal resonance. We'll listen to your heart. Okay? Lots and lots of auscultation going on here. So I am just going to place the stethoscope on your chest, and for the lungs, I'm going to have you take a deep breath in and out. Good. Take a deep breath in and out. 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 Okay. So, with listening to the anterior chest wall, more specifically your lungs, obviously, I haven't heard any wheezing. There weren't any crackles, no coarse crackles, no fine crackles. Now, I'm going to palpate along the heart. We're going to feel for heaves and thrills with my hand, different parts of my hand, and those are palpable heart murmurs. Okay? So I'm going to put my hand on your chest, and we'll just feel for a second. While I was palpating the chest wall, should have taken a detour and did that, but that's okay. Good. And let me feel for the apex beat. So this is going to be your mid-clavicular line and fifth intercostal space down. Okay? Spaces between your ribs, those are the intercostals. So we can come mid-clavicular line here. And then here at the sternum, we can count down to the fifth intercostal space and meet in the middle. So we have right there. Just going to feel that. And then we'll also take a little listen. Good. All right. Right here. So for the heart, you can just breathe normally. Good. Now let's take some little listens around the heart. So here, let's do aortic, and pulmonic, and tricuspid, good, and mitral. Wonderful. And then we get Erb's point right here. Okay. Then let's circle back to that vocal resonance, huh? Kind of been going a little bit around, but we are still going to hit our major points. So when I place the stethoscope on the chest, I want you to say 99. Okay? All right, I'm going to listen to how the word sounds in your chest. Okay, 99, 99, 99, 99, 99, 99, 99, 99. Good. So now we get to do a lot of these tests on the back. So let me go ahead and we will take a little look. Firstly, we'll do our inspection. Looking for scars, deformities, how the chest expands and contracts. Okay. And also just feeling the chest. Good. And would you mind lifting up your arm? Good. And the other side. Good. You can put those back. Now, let's go ahead and do our percussion. So I'm just going to be tapping on your back with my finger. Okay. Good. And then let's auscultate the lungs from the back. So I'm going to have you take a deep breath in here and out. Deep breath in 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 and out. Last set right here. Deep breath in and out. Deep breath in and out. Okay, let's grab that vocal resonance. So every time I place the stethoscope on your back, I'll have you say 99. Okay? All right. 99. 99. 99. 99. 99. 99. 99. 99. Wonderful. There we go. Excellent. So that will be it for your posterior side. Now we're going to move down to the abdomen. So the abdomen has a bit of a different order. We can inspect, then we can auscultate, palpate, and percuss. So the reason we are going to do auscultation first is because the sounds may change when we start feeling around in there, okay? So we'll do inspection, auscultation, percussion, then palpation. So I will just get this one ready, and let's take a look real quick. Okay. Very good. And if you could just breathe normally. Okay. Good. Right, and let's bring in the stethoscope. So I'm going to have you breathe normally through this. So when we have a quiet moment, just wanted to let you know. Been doing everything I've needed to do. Appreciate it very greatly. Okay. Let's get in some of that percussion. We're going to be doing some indirect percussion here, right? This feeling for listening, rather, along the borders. Listening for, is there fluid where there shouldn't be, or is there not fluid where there should be? And then we can do our palpation. Now, palpation on the abdomen has both a firm and deep palpation. So the firm palpation is generally used with one hand. The deep palpation can be done with two. So the deep palpation is a little uncomfortable, but the firm palpation shouldn't be too bad. The only tip I have for you is just keep breathing through it. It shouldn't be painful. If it is, let me know. And other than that, it doesn't last very long. Okay? Alright, so let's do firm palpation first. Good, and then let's do deep palpation. Okay, let's keep breathing. Just like that. Doesn't take very long. Okay, so let's do some inspection, palpation, not so much percussion, and we could certainly auscultate the pulse points. That would be a fun thing to do. But percussion is going to be heading out. So let's start with inspecting and palpating the arms. So we have the shoulder here. And then we come all the way down the arm to the hand. Good. And let's go ahead and look at the other arm as well, from the shoulder here down the upper arm, the elbow right here, forearm, and the hand. So I am going to just check the temperature with the backs of my hands, see if there's any discrepancy, make sure everything is just warm but not overly warm and not overly cold either. So just feel hands up to the arms. The joints can get pretty warm if you're using them. I know if I'm working at the computer for a while, it feels like a sauna, like a burn on my joints. Okay, good. And let's take a look at your elbows, if you wouldn't mind. Good. And have plaques here, maybe somewhere they hide. Good. Okay, let's take a look at your fingers, more specifically the fingernails. I'm going to check the capillary refill on them as well. I just want to make sure your nails are in good shape. A lot of health problems can show up in the nails and the fingers. Okay, so I'm going to just press on each nail and then release. And we want to see the color come back in less than 2 seconds. Just like that. Okay, we're going to press, release, press, release, press, release, press, release. Very good. It's not only allergy season, but it is bird baby season, isn't it? It's one of my favorite sounds personally. It sounds like life. Good. Their mama must have came home. Now let's palpate the pulses. So here we can feel the radial pulse on each wrist. And we can feel the ulnar pulse as well. Okay, and then we can feel the pulse in the crook of the elbow. Feel the strength of it, its rhythm. Okay. And just for funsies, let's take a little listen. So if I could have this arm, good. Okay, and the ulnar. Okay, and the crook of the elbow. And the other arm. Ulnar. Radial. and brachial. Good. Now let's take a little shot at looking at your legs and feet. I'm gonna get a little situated here. There we go. So let's take a peek. So have you had any changes or any abnormalities with the legs in terms of appearance? Okay, and have you had any other problems with the legs? Have they gotten much more fatigued easily? Are they more painful than usual? Any loss in mobility? Okay, good. So here, a big hot spot is the shin. Okay, and then we can look at the foot as well. Look for any edema. Legs can get pretty swollen if there's something going on. Or if you've stood on your feet the entire day, they can get a little swollen too. But we're looking for if there shouldn't be a normal reason why they're swollen. Good. Okay. So let us just feel real quick the pulse at the back of the knee. And this is the popliteal pulse. Good. Let's look at the foot. So I'm going to look at the toenails, their quality, and we'll also do the capillary refill check. Good. Okay, and just going to be pressing on the nails. Press these. Press these. Very good. And let's palpate the pulse at the top of the foot. Good. Good. Now let's take a listen. So while I've got you here, let's do the foot pulse. Side. Good. And then back of the knee. Good. And the other side. Wonderful. Okay, let's put your legs back. And I can get situated back where I need to be. Alright, so I think that will conclude our inspection, auscultation, palpation, percussion, examination. unless there is anything else that you think I should take a look at. Yes, you are correct. So I didn't feel any lymph nodes below the neck. So let me go ahead and feel supraclavicular, and then I will feel under your arms as well. Okay? So let's go ahead and hit right above the clavicle here. Wonderful. And then let's get under the arms. Axillary, I believe. Just need you to lift up the arm a little bit. There we go. Okay, you can put that down. And then let's lift up the other arm. There. Makes it just a little bit easier. Okay, so neither of those felt distended at all. Didn't feel anything out of the ordinary. Now, anything else you can think of? All right, very good. So let me pop off the stethoscope. And I'd like to thank you so much for your participation in this examination. It was very enlightening, and I had a great time, and I hope you did too. Thank you so much. Have a whale of a day, and a good rest of your night. Goodbye now. Hello there. Please come in, sit down. Let me just sanitize my hands real quick. Doesn't that smell lovely? It smells of cucumbers and melons. Perhaps a touch off season, but refreshing nonetheless. Let me see. Would you mind just confirming your name and date of birth for me? Excellent. And is that your preferred name? And how do you like to be addressed? Very good. Excellent. So, today I have something very special for you. You are a participant in an exam that focuses primarily on inspection, auscultation, palpation, and percussion. These are 4 diagnostic methods that all medical professionals that work with patients use to fetter out what may be wrong with someone or to look at different symptoms. So with you, I'm going to be looking at different parts of your body. That's the inspection part. I'm going to be listening with our stethoscope, and that's the auscultation, as I will be auscultating along your body. I'm going to be feeling parts of your body, your skin, the consistency, if there's any lumps or bumps that should be there, versus what should not be there. And finally, percussion. And we have two ways we can do percussion. We have the direct and indirect method. And I'll be using both with you. Okay? All right. Have any questions so far? Okay. I'll likely explain more as we go through the exam. So, as this exam does entail palpation, as well as needing to touch you for other portions, is it all right if I touch you for this exam? Have your permission to do that? Excellent. Thank you very much. If at any point you feel any pain or discomfort, please let me know, all right? Okay, so we're going to be using these different diagnostic methods, and I also will be taking notes from time to time, all right? Okay, so we're going to start with your head. We're going to work down, and we're going to start with inspection. So I'm going to get a little closer. All right, just going to get a little closer. And as we were speaking, I was looking at the symmetry of your head, of your face, the size, the proportion, making sure everything was midline, and that, for example, your ears were about the same level, your eyes were about the same level. And now I am just looking at the quality of the skin, as well as looking at your eyes, looking at your nose, your mouth, your ears, 1 ear, 2 ears. Good, good. Just taking a brief little look. Now, with inspection, we do also use other tools, whether we're using a light, magnifying glass, an otoscope, but for the purposes of this exam, we are just doing a brief, almost cursory look just at the skin, at the hair, at the head. And just ascertaining what I can infer from some light inspection. Okay. Do some palpation, and with the head and the face, this may feel almost like massage. And with the head and face, I'm going to be using a light pressure, and I'm going to feel the contours of the skull. I'm going to be feeling the skin of the face. We're going to be feeling underneath the jaw, everything from the neck up. So once again, I'm going to get a little close, but we're just going to palpate here. Now, oftentimes one will use gloves for this. For certain areas of palpation, the gloves hinder the whole reason you're palpating, as if you're looking for textural differences, for example. The gloves tend to hinder a lot of sensation. And in this instance, just trying to make sure that I'm not provoking any reaction. Just keep sitting still for me as I feel around your head. Normally this is a little more, again, cursory, but here, trying to be a bit more thorough. So with some parts of the exam being a little less thorough, some parts being a little more. So I'm just going to feel right about the hairline. I feel for the occipital nodes. And then we come up and we feel the postauricular nodes right behind the ear. And then if we come back in front, we can feel the preauricular. We can go down a little bit and we can feel the parotid gland around that area. Okay, let me feel the submental and submandibular nodes right under the jaw. And I have to get a little bit of a rolling motion here to feel them. They're a little difficult. Okay, good. Now I'm just going to feel your temporomandibular joint right here. I'm going to feel the masseter muscle. I'm going to feel the temporalis muscle. So let me just palpate this a little bit. Is this tender at all? Okay. All right. If you could open your jaw for me. And close your jaw. Open. And close. Open. And close. Good. Okay, and with the temporalis muscle here. Okay, can you open your jaw? Close. Open. And close. Okay, very good. All right, so lastly, we're going to be doing some percussion. And I'm going to be using the direct method of percussion. Now with this, you may have seen before, I'm going to be tapping along the sinus cavities. So I'm going to feel for any tenderness in that. All right, so I'm just going to come here. Let's start with the frontal. So I'm just going to tap, 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 tap along the sinuses here. You just let me know if they're tender, okay? Any of that tender at all? No? Okay. Any of that? Okay. And how about on the maxillary sinuses? Right across the bridge of your nose, from the bridge of your nose to your cheeks. Anything tender there? No. Okay, very good. a look at the neck. So, just going to be inspecting the neck. Getting a little closer. Taking a little look at the neck. Would you mind just swallowing for me? Good, good, okay. Very good. So I'm not seeing any spots of concern, and the movement looked normal and unobstructed when you swallowed. Alright, so now I'm going to auscultate. And with auscultation here, I'm going to be listening to your carotid arteries here. We're going to listen for something called a bruit. And a bruit is a heart murmur, an audible heart murmur. All right? Okay, give me just a moment. All right, so I am going to put the diaphragm of my stethoscope on your neck, and I'm just going to have you take a deep breath in and hold it so I can listen without any other noises contaminating the sound, and then I'll have you exhale, okay? So if you could just take a deep breath in for me. Hold. Exhale. Good, good, good. And now if you could take a deep breath in for me. And just hold. And exhale. Very good. Easy enough? That's about as involved as this exam will be for you, okay? So next we're going to do the palpation, and I'm going to be very careful about this. I'll let you know when something might be a little uncomfortable so that you're aware and you don't all of a sudden feel discomfort. And we don't need to do any percussion on the neck, just like we didn't need any auscultation on the head, all right? So first, I'm going to feel for the lymph nodes. So here we have the different cervical chain nodes. There's a lot of cervical nodes here. Okay, and just feeling, this might be uncomfortable. I'm going to feel around the windpipe. Yeah, that one's not so fun, but it's real quick. Okay, good. And it is in midline. That's good. Feel any? Okay. And just feeling around the back here. The sternocleidomastoid. The trapezius here, just at the base. Okay. Okay, so I'm not feeling any lumps. Now, I'm just going to put my hands right on your neck, and I'm going to have you swallow again for me. I'm going to feel if there's any movement there that shouldn't be there, right? If you could just swallow for me. Very good. Okay, great. So, neck looks good. So let's work with the chest here. So first I'm going to inspect the chest. I'm looking for any deformities in the chest wall. I'm looking for any bulging, any distension, looking for scars, that sort of thing. So I'm just going to take a look here, look at the symmetry. Just get a little closer, just mapping out the clavicle, the sternum, the rib cage, the side, and the other side here. Now the chest wall includes the posterior chest wall, which is your back. But for the purposes of this exam, we're just going to stay in front. Okay. Very good. All right, everything looks good that way. Now we're going to do some palpation. First, I'm going to feel the supraclavicular nodes right above the clavicle, as the name suggests. I'm just going to just feel this little. Okay. And then I'm going to feel the chest wall. And then we'll get a little fine-tuned in a moment. Just feeling with my hands any deformities. Okay, and just for funsies, I'm going to put my hands on your chest here. And if you could take a deep breath in for me. And out. All the way out. And take another deep breath in. And out. Feeling a little bit of chest expansion in that. You can keep breathing normally. So, just feeling the sternum and the bottom part, which is my favorite part on the body. Well, the name is my favorite, which is the xiphoid process. What a name. Okay, good. And now I'm going to feel around the heart, okay? So I'm going to put my whole hand here. I'm just going to wait here for a moment. There's such a thing known as heaves and thrills, which are palpable heart murmurs that you feel with different parts of your hand. And I'm just going to feel with the heel of my hand here. Okay, now let's locate the apex beat. So this is going to be at your midclavicular line, 5th intercostal space down. Intercostal is the space, that muscle between each rib. So if we go mid-clavicular line, and 1, 2, 3, 4, 5, and feel right there. That should be our apex beat. Very good, very good. Okay, so now we're going to do some percussion. And this type of percussion is the indirect method, which we'll be using henceforth. So with the indirect method of percussion, I'm going to place one hand, we're mostly focusing on the fingers, on your chest in a specific place. And with the fingers of my other hand, I'm going to be tapping. Now you could just do one tap. I like a good 2 tap. Has a good rhythm to me. but I'm going to be listening to the sound that comes back. For example, we can tell if fluid is in a place where it shouldn't be, or if there's not any fluid in a place where there should be, and we can listen to the borders, contours of the organs as well. But I'm going to be listening to the different sounds that are made as I work down the chest, okay? Listening around your lungs primarily. So, I'm just going to place my hand on your chest, and then we're going to tap, 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 tap. You got to be real quick on the drawback so you can listen. Okay, so just going to. Good. Okay, and that was just up at the top here. Now we're going to get into down into the chest. Okay. Okay, very good. And now we'll get into auscultation. So we're going to be listening to your lungs as well as your heart. Let's go ahead and start with the heart. So we're going to start with listening to the aortic area of the heart. So you can just breathe normally at this point, okay? Okay, we're going to move to the pulmonic. And the tricuspid valve. And the mitral valve. I'm going to be listening to Herb's point. Okay, and then let's take a listen to your lungs. So this time I'm going to be moving in the same fashion that I did before with the same points that I use with percussion. So we're going to be taking a listen, and I'm going to be having you take a deep breath in and out. Okay, so each point I'll have you take a breath, and I'll work in that ladder pattern down your chest. Okay? Alrighty, so if you could take a deep breath in for me and out. Nice big breath. Deep breath in and out. Always comparing left to right. Deep breath in and out. 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 Okay, and deep breath in and out. Deep breath in and out. good. So, had no signs of anything like wheezing or fine or coarse crackling, which I didn't expect anyway, but just to make sure. Okay, so let's go ahead and move on to the abdomen. Now with the abdomen, we change up our order a little bit. So for this, we do our inspection, auscultation, percussion, and palpation. With palpation, we are going to do our light pressure like we have, in addition to doing a deep pressure. Okay, so 2 types of palpation, indirect percussion. The order changes a little bit. And that's because when we palpate and percuss, that's going to change the sounds that are generated in your abdomen. So we want to capture those before we go messing with everything. Okay? Okay, so we're going to do a little inspection. All right? And just take a little look here. Okay. Doesn't seem to be any bulging or sunken in areas where there should not be. That's good. Okay, very good. Let's go ahead with our auscultation. Okay, so here I'm going to listen across the 4 quadrants and more specifically the 9 different zones of the abdomen. All right, so I just want you to breathe normally for me, okay? And we're just going to take a little listen. Doing really well. Been a model patient this whole exam. I appreciate that. And that is the end of the stethoscope. For the rest of the exam, we will not need to auscultate any further. Okay? Now we're going to work with percussion. And just like with the chest, we're going to be using our indirect percussion, in which I'm using my fingers, okay? Just like that. And I'm going to be tapping along all the areas that I just listened to. It's going to be quite a bit, okay? Much more than on the lungs. So do let me know if anything is tender or painful, okay? All right. Doing okay? Now we're going to do our palpation. So I'm going to start with the light pressure, and that one, not usually uncomfortable. It feels just kind of weird to have someone press on your stomach. With the deep pressure, that one is uncomfortable. So I'm going to have you just do your best to breathe through it. And that one will not take too long, okay? So just breathe through it all. It doesn't last very long, okay? All right, so with the light pressure, you pretty much use one hand. With the deep, tend to use two, okay? We're going to start with the light pressure. And how is this? Manageable? Okay. Always found this part fascinating. It's just interesting that we can physically feel the organs with our fingers. It's never failed to draw my awe. Okay, and now we're going to do the deep pressure, in which I use both my hands and a good amount of pressure. Again, please let me know if there's any pain or tenderness, and try to breathe through it. All right? Okay, ready? Here we go. Doing okay? Okay, maybe I talked it up a little bit. Yeah, well, I'm glad it's not as bad as I built it up to be. People, I mean, it's understandable if people get a little squicked out by someone rifling around in their abdominal bins. That's, the place where your organs are not protected. It's just kind of soft there. Just have the muscle in your skin. So, of course, it's what is the word? Not exactly primal, but it's instinct to be a little on the uncomfortable side when someone's really pressing deep in on your abdomen. Okay, very good. All right, you survived that. So that part is complete. Now with the extremities, we can do inspection and we can do the palpation. Now I can get a little bit of percussion, a little bit of direct percussion if we do the Tinnell's test on the wrists, but otherwise it's mostly inspection and palpation, okay? So let's go ahead and start at the shoulders. We'll work our way down the arms to the hands, okay? So let's do inspection first. And let's start with this side, okay? I'm just taking a brief look here. Looking at the skin, the muscle. Looking for any signs of injury, any, in the case of by the elbows, any plaques. Down the arm, into the hand. Would you mind just flipping your hand over for me? Okay, good. And up. Okay, very good. And now the other arm. Just taking a little look. would you mind flipping over your hand? Good. Good. And would you mind showing me your elbows? Okay, good. All right, you can put them down. So now I'm going to get into the palpation, all right? Please let me know if anything is painful or uncomfortable, okay? Just going to be grasping on to arm. There's some lymph nodes in here, but really there's few instances where we would feel those. And then with the elbow here, I'm going to be feeling any pain here, tenderness. Sometimes when we get tendonitis, we have pain right on the sides of the elbow, like I do. Okay, and along the arm here. Okay, you mind if I rotate the wrist a little bit? Good. Okay, and you mind if I take the weight of your arm and I'm just going to move it around a little? Okay, so I'm going to look at a little bit of the range of movement. Any pain with any of this? No? Okay. All right, and let's do that dental test. So I'm just going to be just tapping along the wrist here, and if you have carpal tunnel, this can be a test for that. I get a little twinge at this, not too much, just a little bit. But you seem to be doing okay. Yeah. All right, let's feel the hand. So feeling for any wasting. The thumb, side of the hand here. Okay. Feeling the snuff box. It's my word of the day. My partner, I was telling him that I had injured my snuff boxes, which your anatomical snuff box is this area right here. And he thought I was the most pretentious person in the room. And he's like, who the hell knows what a snuff box is? And I said, okay, dude, what is that area then? What do you call that? He goes, I don't know, your thumb? I'm like, but it's not quite your thumb, though, is it? I don't know, your hand? But it's not quite your hand. I mean, yes, it's part of it, but guess what definition fits in there? Anatomical snuff box. I think he was just upset that I knew something that he did not. So I have proceeded to tell the world all about what the anatomical snuff box is, because when you injure that, oh mama, holy blonde cheerleader Batman, life is painful. Got a little bit off topic there, but I'm gonna feel around your joints now, and you let me know if there's any pain or discomfort. Feel the proximal and the distal joints and the phalanges. Proximal being closest to you, distal being furthest away. Okay, and now I'm gonna have you split your hands and I'm gonna push them together, okay? You let me know if that's painful. Okay, no? Alright, very good. Okay, lastly, let's go ahead and look at your cap refill on your nails. sign of good circulation, as if it pretty much instantly flows back. Goes from pale to more pink. Okay? Alright, and now the other arm. Let's go ahead and just feel around the bicep. We have the humerus bone here down to the crook of the elbow and the crook. The crook of your elbow is known also as the cubital fossa, which is another $10 word that my partner was not exactly pleased to hear that there was a more scientific word for it. Again, I think he just wants to know more than me. He does not. Okay, and just feeling around. Does this feel painful at all? Tender or painful? Good. Make sure to take care of your tendons and your joints. They'll haunt you. They will. Make sure to keep an eye on them. Get some good stretching. No video game marathons. Okay. Alright, let's go ahead and roll the wrist a little. Any pain in this? No? Okay, and let me take the weight of your arm. And we'll do a little, just a taste of range of movement. Okay. Any pain with any of this? No. Okay. Alright, let's do our tingle test. Percussion on the wrist. Anything here? Nope. Alright, very good. Let's look at the muscle in the hand. Any wasting? Nope, it all looks nice and firm. Okay, the snuff box here. And let's feel the joints. Proximal, distal, proximal, distal, proximal, distal, proximal, distal. Very good. Very good. Okay. Display your fingers for me. I'm gonna try to bring them together. Okay. Good. And let's look at the cap refill. That's all good as well. Very good. So let's look at your legs and your feet, okay? So let's do some inspection first. So let's see. Okay. Not seeing any skin abnormalities. And the feet look good. They don't look swollen. Okay, let's go ahead and feel around. Okay, so let's start with the thigh. It's a very, very powerful muscle there. Any of this painful at all? Anything in the IT band here? Iliotibial band? No. Okay. Good. Right, and what about by the knee here? How are we feeling about the knee? Feeling okay? Alright. I'm just gonna feel at the back of your knee. I'm gonna feel pulse there. Okay. And I'm just gonna look at any fluid around the knee. So I'm gonna push forward on the top of your knee and feel around. Okay. Right, and down the shin and the calf muscle. Okay, good. And the foot here. Feel the ankle. Feeling for any signs of edema. And I'm just going to roll your ankle a little bit, okay? Is any of this painful? No? Okay. Good. I'm just going to feel the foot. Okay. And let's look at the capillary refill on the toenails. Okay, good. So good circulation in the feet. Let's look at the other leg. Start with the thighs. And the knee. Any pain here? No. The pulse, the back of the knee. Good. And down the calf, the tibia and fibula. I found it to be a missed opportunity that tibia and fibula did not exactly rhyme. So, for many years I thought it was tibia and fibia, because that makes sense. Or even tibula and fibula would make sense. But tibia and fibula. At that point, just don't do it. But alas, it's not how the world works. They did not consult me when they named the bones of the lower leg as thus. They should have though. Okay, and the ankle. Feeling for edema. And let's roll this one around. Just a little bit of crepitus in this. It's not bad. I swear I moved my leg like 1 centimeter to the side and it's like I stepped on a cellophane bag. Okay, and let's feel the foot. Ooh, excuse me. I'm just going to feel the capillary refill. Look at the capillary refill. Good. That looks great. Okay. So, that'll do it. Very good. Okay. So I'm just going to take a few last minute notes, just tying it all together, and then we'll get you on out of here, all right? Let me just sign off. Okay. And we are all finished. Do you have any questions for me at all? No? Okay. So I'd like to thank you so much for your participation in our examination. I greatly appreciate it. I hope you have a whale of a day and a good rest of your night. Thank you. Goodbye now. Hello there. Welcome to my office. My name is Dr. Calliope. How you doing today? Okay. I hope by the time you leave this office, you feel even just the littlest bit better. So let me see here. All right. Do you mind just confirming your name and date of birth for me? Okay. Very good. And is that your preferred name? And how do you like to be addressed? Okay. Very good. Thank you. So it looks like today we are doing a percussion and auscultation examination. Is that correct? Okay. Any particular reason why you wanted this exam? Okay. Very good. Right. Do you have any current pain or illness going on? No. Okay. All right. And any changes to the medical history we have on file here? No. Okay. Very good. And what about your family history? Any changes there? No? Perfect. Good to hear. And what about your allergies? Any changes with those? No? And your medication list, are there any changes to that at all? No? Okay. Very good. All right. So, our auscultation and percussion examination today is going to primarily use two different tools. The first is going to be the stethoscope. That's going to be our main star of the show. And the other tool that I'm going to use doesn't exactly seem like it would be a tool that we would name, is my hands. More specifically, when we do percussion, I'm going to be placing my hand on different parts of your body, and with the other hand, I tap onto my hand. I listen to the sounds that echo back. That tells me if an area is hollow or if there's fluid, and I can listen to the quality of sound to ascertain what exactly is going on in that area. Sometimes you get the hollow sound, sometimes you get more of a stony, dull sound. Just depends on what area we're on and what exactly we're looking for. Okay? So the auscultation is going to be the main first step, and then we'll move on to percussion. When we do auscultation, we are focusing on the lungs, the heart, and the abdominal area. I can also do our percussion on all of these areas as well. But with percussion, we're mostly focusing on the lungs and the abdomen. Okay? Any questions so far? Right, so the percussion, it's not going to have any pain involved. It may feel a little strange to have someone just tap, tap, tapping on your chest and your abdomen, but I'm really only using enough force just to make sure that I can hear the sound echoing back. So it's not something that'll be painful. Maybe a little weird, but definitely not painful, okay? And if it is, you just let me know, all right? Any other questions? Okay, so I'm not going to need any gloves for this examination, and I'd like to ask if, from this point forward, if I can touch you for the purposes of this examination, if that's okay with you. Excellent. Thank you so much. So we're going to start with our auscultation. Just going to grab our stethoscope here. Okay. And I'm just going to be popping that in. So, generally, when we use our auscultation technique, we have a stethoscope that has both the diaphragm and also generally on this side they have a bell. And these different tools are used to look for different frequency sounds. One of them is much better at picking up low frequencies, and the other more with high frequencies. I just have a diaphragm here, but for the purposes of this exam, I think this will do just fine, okay? If you have any concern, we can always do another one down the line where I have a more dual purpose stethoscope, okay? All right, so I'm going to come in real close here, and we're going to start by taking a little listen to your lungs, okay? So I'm going to start here at the top, and I'm just going to have you take a deep breath in for me and out. The other side, deep breath in and out. And a little bit down, deep breath in and out. Other side, deep breath in and out. Down, deep breath in and out. Other side, deep breath in and out. Good. Let's get up by the clavicles here. Deep breath in for me and out. Okay. Deep breath in and out. Good. Let's come around to the side. Deep breath in ahead and run through that again, okay? I'm going to place my stethoscope here. Take a deep breath in and out. Deep breath in and out. Little down. Deep breath in and out. 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 And up here, deep breath in and out. Deep breath in and out. The side here. Deep breath in and out. Deep breath in and out. Good. And let's do that one more time. Okay? Do you need a little break? Getting any lightheadedness? Okay, very good. So, start right here. Take a deep breath in for me. And out. Deep breath in. And out. Deep breath in 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 and out. Okay. Deep breath in and out. Good. Deep breath in and out. Deep breath in and out. Deep breath in and out. Good, good. So I'm just going to take a moment and you just breathe normally. Catch your breath a bit. just like to note down a little bit. Very good. Can you hear those morning doves? There is a mated pair of mourning doves that we've had around here for over a year. They're always eating together, always drinking out of the bird bath together. It's really something sweet. Alright, so let's go ahead and continue. And this time I'm going to listen around your heart. So your heart, primarily going to focus in this area here. I'll come around a little bit to the side as well, but mostly focusing here, okay? During this, I want you to just breathe normally for me. You don't have to take deep breaths or anything, okay? So we start with the aortic valve, and we just stay here and listen. Just listening for the sound, the rhythm, how the rushing sounds, a rush of blood. And we move over to the pulmonic area. Just listening for any murmurs, anything out of the ordinary. Then we go to tricuspid valve. And the mitral. The heart sounds nice and slow and steady. I don't know about you, but oftentimes when I am getting an examination, I'm just going to listen to the side of your chest here. I'm getting an examination. No matter what I do, even if I don't think I'm feeling any anxiety, I have a racing heart that never stops. My personal record was, I believe, 110 beats per minute last time I went. And the nurse asked if that was normal for me. And I said, when I go to the doctor, yeah. But 110 is a personal record. Okay, I'm going to listen to Herb's point here. Just keep breathing normally for me. Okay, and I'm going to find the apex beat here. So this is the mid-clavicular line, and I'll count 1, 2, 3, 4, 5 intercostal spaces down. Good. So let's go ahead and listen to that again. I'll start with the aortic. Pulmonic. Tricuspid. The mitral. Just around to the side here. And Erb's point. And the apex beat, which we had pegged right about here. Okay. And one more time. Start with the aorta here. Aortic. Pulmonic. Tricuspid. Mitral on this side here. Side. And Erb's point. And the apex beat right here. Okay. Alright. Take a little breather there. Okay. Now we're going to auscultate our final part of the body, and that's going to be your abdomen, your digestive organs. So there are 9 main areas that I listen to, so you'll kind of just feel the stethoscope going around in a bit of a systematic pattern. So I'm just going to pop that in. This will be a little quicker than the other auscultations. There we go. All right, so just going to have you breathe normally for me. Okay. I'm just going to take a listen. Okay. Still doing okay. Okay. Just mostly intent on listening around the abdomen. There's a lot to listen for in this part. But I'm just going through again our 9 different areas. Making sure the right sounds are in the right place. Okay, and one last loop around the bend. Last 3 here. Excellent. All right, we can put that away. Just good. After a while, that stethoscope starts to feel real constricting. Let's see. Okay. So now we start in on our percussion. As I had mentioned before, percussion is going to involve me placing my hand in different areas and tapping on my finger that's laying on the area I want to listen to. So you don't have to do anything special, okay? Just keep breathing normally for me. And I'm going to start in the chest cavity, chest wall, and then we will do your abdomen as well, okay? All right, so I like to start right about here, and I'm just going to be tap, tap, tapping, okay? Good. All right. I'll come down a bit. Okay. Want to know a fun fact? Your lungs have 5 lobes in total. Your right lung has 3 lobes, while your left has 2. Your right lung is bigger than the left. It's also heavier than the left. Your left lung has to share space with your heart. So it's a little smaller and only has 2 lobes. We're going to do that again. Know another fun fact? Didn't used to be that doctors were so gentle with the percussion. They used to not buffer it at all. Basically just hitting on their patients. Medicine has come very far in a very short time. It used to be much more painful to get an examination. Nowadays, we try to keep your comfort in mind, at least the good ones. Not the good patients. It's not like I'm going to all of a sudden just slam on you if I don't like you. Or will I? Good. Good. Let's go ahead and do that along your abdomen, okay? So when we use percussion here, oftentimes we're going around borders of organs. I mean, it's a lot more involved than when we do the auscultation, okay? There's a lot of organs here. We're not dealing with, a couple of sacks full of fluid. We're dealing with many sacks full of fluid, to put it indelicately. So there's a lot more percussion with the abdomen, all right? But again, it should feel quite similar to the chest wall. It might feel just a touch more force because it's on soft tissue rather than bone, right? The bony prison that is your ribs. So just keep that in mind. Keep breathing normally, okay? All right, just let me know if you need a break. One last go around. Okay, that'll do it. It's lots of little taps. All right. Okay, very good. It'll just take me a moment to write down my findings, all right? Let's see. All right, so I know I've made you wait for a second regarding the findings, but believe me, if there was something wrong, I'd tell you before I wrote it down. So that all sounded great. Your lungs sounded free and clear. It doesn't sound like there's any fluid buildup anywhere. And upon percussion, it doesn't sound like there is any dullness, any stoniness in the lungs as well, which is good. I didn't hear any crackles or any wheezing when we were doing our auscultation. Your heart sounds strong and steady. I didn't hear any signs of any murmurs, okay? And that was across all the valves, all the areas, very strong. Sounds like you've got a good heart in you. And your abdomen, I heard all the normal digestive sounds. Doesn't seem to be any fluid where there's not supposed to be any. Contours were normal. Everything sounded quite textbook perfect, I think. Okay? All right. Do you have any questions for me? Yeah, I think the feeling of having your abdomen tapped on many times, that'll go away shortly. It doesn't really have any effect on your abdomen, save for maybe you'll get a few rumbles. Other than that, there's nothing really harmful to it, okay? All right. Anything else? Okay, so I'm just going to go ahead and sign off here. Very good. And that will end our auscultation and percussion examination. Thank you so much for coming to my office to have this examination. I hope that you have a whale of a day and a good rest of your night. Thank you. Goodbye now. Hello and welcome. Isn't that a wonderful smell? New hand sanitizer, pineapple and coconut. There we go. How are you doing today? Okay. Well, I hope at the time you leave this examination today, you feel even just the littlest bit better. So my name is Dr. Calliope, and I'm going to be performing a very special examination today with you, okay? Would you mind just confirming your name and your date of birth for me? Excellent. And is that your preferred name, and how do you like to be addressed? Excellent. All right. I'd just like to ask you a few medical history questions, if you don't mind. Okay. So, firstly, are you in any current pain or have any current illness at all? Okay, excellent. And any changes to the medical history that we have on file? Okay. Excellent. And what about your family history? Everything still good there? Great, that's great. Okay, and any changes to your allergies at all? Okay. Excellent. And what about your medication list? Anything new? Any changes there? Okay. Excellent. So that's all I need from you information-wise. So today we're going to be doing an auscultation, percussion, and palpation examination. And just as the name suggests, we're going to be auscultating or listening. It's a very professional medical term for listening. We're going to be percussing, which is when I take my hand and put it on a body part and tap on it so I can listen to the sounds that come back. And palpation, which is going to be touching you, okay? So there are quite a few different places on your body that we can perform this examination. So we're just going to run through everything. It'll be nice, simple, and easy, okay? All right, I'm gonna pop on some gloves real quick. So for this examination, I am going to need to be touching you. Is that okay with you? Do I have your permission to do that? Okay, great. All right, smells like a tropical getaway in here. That pineapple coconut sanitizer really does the trick, huh? All right. So, we've got some gloves on, and we're going to start with auscultation. So instead of running through everything we can auscultate all at once, we'll go section by section. So we'll do auscultation, percussion, and then palpation on each specific system. Okay? So for auscultation, we need our stethoscope. I'm just going to pop that in. And the first thing we can start with is your chest. We can auscultate your heart and your lungs, okay? All right, so all you need to do for me is just relax, okay? And take normal breaths, all right? I will prompt you if I need you to take a breath in or out, but for now, just breathe normally, okay? So I'm just going to put the stethoscope on your chest here, and we're going to start by listening into your heart, the cardiovascular system. So we're going to listen to each of the valves of your heart, the mitral, the tricuspid, the pulmonary, the aortic. And I'm listening for any abnormal sounds, like a heart murmur. I'm listening for how the beats sound. Okay, just taking it nice and slow. Listening to the atria, listening to the ventricles, the aorta. Just real relaxed here. Okay, and I'm just going to come onto your side here, so by your rib cage. Okay, just along the rib cage. And we're just taking a nice slow listen. All right, so we've completed our auscultation. So now we're going to do some percussion. We don't necessarily have to do any percussion on the cardiovascular system, but for the sake of the examination, we're going to, okay? So I'm just going to start a little bit above here, okay? Just moving along the rib cage in strips. Okay. Okay. Doing okay so far? Okay, very good. So now comes the palpation. Now, when we're working with the cardiovascular system, we're working with the heart. What I'm doing when I'm palpating is I'm feeling around your rib cage. I'm feeling for any heaves or thrills. So that's different types of heart abnormalities that one can feel with their hands. So I'm going to start by mapping out your apex beat, which is the mid-clavicular line, so right here, and then we go down 1, 2, 3, 4, 5 intercostal spaces, and we'll just wait here for a moment. We'll feel that apex beat. Okay, so feel for heaves and thrills. I'm going to use different parts of my hand to feel for those abnormal beats. Okay, I'm going to use the heel of my hand here. Just keep breathing normally. You've done really well for me so far. Alright, now I'm just going to feel around a little, just very gently, so that when we go into listening around your lungs, we're not aggravating anything. So, I think we'll do a little bit more palpation with feeling your lungs. So we'll feel for any bulges or any cave-ins in the chest wall. But right now, just doing a little bit of palpation. Okay, I'm going to put my stethoscope back on and we're going to move to our respiratory system, or your lungs. Alright, so this is where I'm going to have you take some deep breaths for me. So I'm going to place the stethoscope onto your chest, and I want you to take a deep breath when I prompt you, okay? So take a deep breath in and out. Good. Deep breath in and out. Deep breath in and out. Deep breath in and out. just going to have you breathe normally. I'm just going to listen around your lungs. So primarily what I'm looking for is any abnormal lung sounds. There wasn't any crackling or wheezing in the lungs, which is good. It doesn't sound like there's any obstruction. You're able to breathe in fully and exhale fully. Just keep breathing normally. Okay. Okay, very good. All right. So now we're going to do a little percussion. So I'm going to have you breathe normally, and I'm going to be doing quite a bit of percussion over the front part of the chest wall. And oftentimes what this is used for is determining if there is fluid in places there shouldn't be, or if there isn't fluid in places there should be. So that's what we're going to be listening to. If your auscultation serves any sort of indication, you probably don't have any of those problems, but we like to be thorough. Now we're going to do some of that palpation. However, it's going to be a little more extensive. As I said before, we want to primarily focus on if there's any deformity in the chest wall. So I'm just going to be feeling all around your chest here. So the funny thing about percussion is it's one of the older types of diagnosis, and it didn't used to be that you tapped on your hands. It used to be that they actually put force on the person themselves without a buffer, and that was pretty painful, obviously. And eventually they figured out that they could do the same thing while not hurting the person nearly as much. That's been used quite a bit, and I imagine it was used quite thoroughly with things like tuberculosis. So seeing as that was one of the biggest major disasters in the world's history, and was up until very recently. It's funny how we think that it was, 200 years ago people would die of consumption, but it was actually fairly recently that it really started to really started to decline. I know people who have had tuberculosis, which is funny. It's not nearly as serious as it used to be. It's treatable, which is excellent. But one would need percussion to determine if the lungs were holding fluid, if one had tuberculosis. It's a very useful tool. Okay, so I'm not finding any deformity in the chest wall, which is good. There's no bulges where there shouldn't be. There's no valleys where there shouldn't be. So now we're going to do a little detour here, a little mini side quest, if you will. And I'm going to listen to and palpate your carotid arteries in your neck. We're not going to do any percussion. That's not needed in this particular scenario, and that would be pretty uncomfortable as well. So we're just going to stick with auscultation and percussion. So I'm going to pop in my stethoscope, and I am going to prompt you how to breathe with this one. So if you could just turn your head to one side. Good. Okay. So if you could take a deep breath in for me and hold it. Okay, go ahead and exhale. Take a deep breath in for me and hold it. And exhale. And take a deep breath in for me and hold it. And exhale. Okay. So what I'm listening for with your carotid artery is I'm listening for bruits, which are audible heart murmurs. So I'm going to have you turn your head to the other side. Okay. Take a deep breath in. And hold. And exhale. Okay, take a deep breath in. And hold it. And exhale. Take a deep breath in for me. And exhale. Very good. So that's very good. And now we're going to do a little bit of palpation. This might be a touch uncomfortable. Okay. I'm just going to feel each side of your neck here. So normally, the stethoscope that I would use, in addition to having this flat part, it would also have another head on it, and that would be the bell. But we're just doing something real simple here. The two different sides of the stethoscope are better for hearing certain frequencies or certain sounds, lower sounds, higher sounds. Now I'm going to have you turn your head. I'll feel the other side. But this is just real simple and easy for us today. Real simple, real easy. Okay, very good. So you can go ahead and look straight ahead. All right. Need a minute? Are you doing okay? Okay. So we're going to move on to your abdomen now. And then lastly, we'll go ahead and take a listen and a look at your back. Okay. So we're going to do our auscultation first, then our percussion, and then we'll do some palpation. So with auscultation, we're listening to your different digestive organs primarily. So you want to just lay back a bit for me? There you go. Okay. So I'm just going to be listening to you all over your abdomen here. Doing okay? Okay. It can be a little uncomfortable just having somebody listening to you. And in order to listen well, there's a bit of a limit on conversation. But when we get into palpation, it won't be like that. Okay. So we're going to go ahead and do some of our percussion. And in this case, we use percussion primarily to map the borders of your organs. So there's going to be certain sounds where perhaps your liver is. There's going to be other sounds where perhaps your intestines are. So it's really quite interesting to be able to map the body using only sound. Isn't it? Yeah, real neat little thing. The world works in fascinating ways. I often tell people that I hear from ultrasound techs, and they could be taking a break or in the hallway, and someone else is running the ultrasound machine. And just based on the sounds, they can tell what's going on, what's being looked at, and what might have been found. I find that absolutely fascinating. To be trained to hear those little variations. Just like when we're testing the borders of the abdomen. Like here, bit of a different sound, right? So that is where one of your organs is, as opposed to a little bit more empty space. We're just listening around. Quite a bit of percussion, but there's a lot of real estate happening. We're going to move on to palpation. We're going to do two types of palpation. First, we're going to do a light pressure, and then we're going to do a deep pressure. So for the deep, it can be a little uncomfortable. I just want you to be aware of that. Have you had any pain or tenderness in your abdomen at all? Okay, please let me know if you do, okay? That's very important. So now we're going to be actually feeling your organs. So we're going to start with the light palpation. let me know if there's any pain or any tenderness at all. I'm just going to be thoroughly checking your whole abdomen. Using a two-handed approach here. Alright, we're going to go ahead and do our deep pressure, okay? So just try to breathe normally through it. It doesn't take too terribly long, okay? Alright. This is where we put a bit of weight into it. And again, just let me know if you feel any pain or tenderness, sharp, dull, what have you, okay? So that's it on that part, okay? So you can take a few moments just to take a little break, okay? I know that's not fun, but I'll give you just a moment. While you're doing that, I'll just go ahead and write down some of our results so far. So we've taken a little listen and done all the bits with your heart, your lungs, your carotid, and your abdomen. Okay? So lastly, we're going to do all of that, but we're going to do it on your back. So I'll be feeling around, listening to, percussing primarily your lungs, and then we will get a little further down. So generally what you're feeling back here is the kidneys are the biggest organ that we're looking at, okay? So I'm going to be out of view for a little bit. I will come back, of course, but I want you to know that, okay? So I'm just going to pop around you. Okay, so we are going to start with our auscultation. I'm going to pop my stethoscope in, and then I'm just going to be taking a listen to your back. So I'm going to tell you when to breathe, okay? So take a deep breath in and out. 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 Lastly, deep breath in and out. Okay. Take out the stethoscope and we are going to do our percussion on your lungs, okay? Okay, so now we're going to go ahead and do our auscultation, or rather, we're going to do our palpation since we've already done our percussion and auscultation. So just like the front of the chest wall, I want to be feeling for any deformities. So I'm just going to take my hands and work along your back. And see if there are any abnormalities. Alright, so let's go ahead and move on to our last part. And this is where I'm going to do our auscultation, our percussion, and our palpation below the rib cage. I'm going to pop in the stethoscope. And I'm just going to place it on your mid back and it'll go down to your lower back. So you can just breathe normally for this part, okay? All right. Just taking a little listen while you breathe normally. Sounds are a little more muted back here. Have to listen a little harder. Okay, and then we're going to do some percussion. So I want you to let me know if there's any pain or any tenderness, okay? Especially since we're dealing with the kidneys back here. So just going to start percussing on your back. Okay, now we're going to finally do our palpation. So again, let me know if there's any tenderness. We're going to start below the rib cage and work down to the low back. I'm going to go ahead and come back to the front. All right, and here we are again. So how are you feeling so far? Okay, so I just want to take some notes regarding back of the lungs and back of your abdomen. Covers it. So I'm just going to put my stethoscope away. So that about covers our examination today. I didn't find anything out of the ordinary. Your lungs, your heart, your abdomen, your back, your neck, everything sounds normal, okay? I didn't find anything that we would have to be concerned of, okay? Do you have any questions, comments, or concerns for me? Okay, very good. So I'm just going to sign off on your examination sheet here. Okay, and we're all good to go, okay? So thank you so much for coming to me for this examination. I hope that it was relaxing for you. Appreciate you being here. I hope you have a whale of a day and a good rest of your night. Thank you. Goodbye now. Thank you so much for watching this video. I really appreciate it. I create primarily medical, alternative medicine / pseudoscience and personal attention ASMR roleplays. If you want to check out a specific category of my videos, my channel playlists have everything from sci-fi to historical to even fantasy videos. If you want to support my work, consider checking out my Patreon profile in the description box, where I offer early access to videos, exclusive content,